My name is Kevin Jacobson. I'm a medical doctor, PhD student working at the Department of Dermatology in Copenhagen. Today I'll be sharing a very exciting project where we use the newest technology, line-field confocal optical coherence tomography, to visualize the eccrine sweat ducts in axillary hyperhidrosis patients after either microwave thermolysis or botulinum toxin A treatment. I have no disclosure. All right, so as you may know, axillary hyperhidrosis is a chronic sweat condition which has shown to significantly reduce the life quality of patients affected by it. It is believed to affect the eccrine and apocrine sweat ducts exiting through the skin surface or the hair follicles respectively. Now, in the middle you can see my colleague Gabriella, who recently provided some new insight into the field by comparing two known treatment modalities for axillary hyperhidrosis, namely microwave thermolysis and botulinum toxin A. They were able to show a significant sweat reduction that was equal in both groups at 1 year follow-up. And as you can see from the image, there's a patient from the study, which microwave thermolysis on the right side and botulinum toxin on the left side, stained with iodine starch. You can see a clinical visible sweat reduction at 1 year follow-up. But despite these promising results, there's still limited understanding of this underlying skin tissue interactions. So we postulated whether it would be possible to use the newest non-invasive imaging technique to visualize these changes. And I'm talking about the line-field confocal optical coherence tomography, or abbreviated LCCT, which uses an 800 nanometer laser, can provide 1 micron resolution images and can go down to a depth of 500 microns, which is approximately the superficial dermis. And while it's a relatively new technique, it has been demonstrated for utility in dermatology in several recent studies. So now that you know a little bit about the background and the aim, we wanted to use the LCCT to visualize the eccrine ducts in axillary hyperhidrosis patients after treatment with either microwave thermolysis or botulinum toxin. So this was the study design. It was explorative in nature. It was a sub-study based within the RCT study published by my colleague. We used 8 patients and 16 axilla for each treatment modality, imaged at baseline and 6 months follow-up. And the images were collected within the transparent template as visualized in the image back here. And we also took biopsies to compare with as a gold standard. Now these are the baseline results. So expectingly, we could see the eccrine and apocrine glands deep within the hypodermis, as well as the eccrine ducts going upwards superficially. When comparing these results to the LCCT images, I drew this red line to show the depth penetration of the LCCT, which is down to 500 microns. So while we were only able to see the superficial aspect of the eccrine ducts using the LCCT, we were able to see them in great detail, including the eccrine pores exiting through the skin surface, as well as deeper the eccrine ducts and the surrounding collagen, visualized in the red arrows. All right, so looking at the 6 months follow-up results, we were happy to find a consistency in the microwave thermolysis treated patients, observed by, in the majority of cases, we saw obstructed pores and atrophic eccrine ducts. In this exemplary image, we see a well-defined eccrine pore at baseline, and at 6 months follow-up, it appears to have deteriorated in containing debris-equal material within its core. When comparing these results to the botulinum-treated patients, we saw no visible changes using the LCCT in any of the image cases. And so as demonstrated, we can see that there's a well-defined eccrine pore at baseline, as well as 6 months follow-up. And finally, these results were comparable to histology reports. To conclude, although the full range of sweat gland morphology is not visible with the LCCT, we are able to see the superficial eccrine ducts using the LCCT in great detail, both in the epidermis and superficial dermis. And moreover, we're able to make out visible treatment outcomes in the microwave thermolysis patients visualized by obstructed pores and atrophic eccrine ducts, but we were not able to see any changes in the botulinum toxin-treated patients, and these findings align with histology. Sorry, I'll go back. And so, while this is an explorative study, it needs to be confirmed in larger studies, of course. However, I truly believe that the results reflect that LCCT has great potential as a technique to visualize treatment outcomes after energy-based interventions. And with that, I would like to thank my professor, Meret Heatherstell, as well as the committee for having me.